Do you have a sharp pain in the front of your hip, especially when you're doing things like squats or lunges, or even if you're just sitting for too long? Does it sometimes feel like your hip is stuck or it's jammed? It just doesn't move the way that it used to? Maybe you've even tried things like stretching, but it's never really gone away. It's always stuck around. If that sounds familiar, then stick with me because we're going to be breaking down exactly what's happening inside the hip and what we can do to solve it. Now let's break this down really simply. Your hip is a ball and socket joint. It allows lots of different movements within the hip. Internal, external rotation, flexion, extension, everything. Now that ball should glide smoothly inside that socket when you move. But with hip impingement, what is happening is the ball starts to pinch or rub against the inside of that joint, that socket. So when you lift your knee, for example, you can start to pinch at the top on the anterior version, okay? Or maybe as you're doing internal or external rotation, you start to push along the inside of the socket, and that's where you'll start to feel that grinding, that creaking, or that pinching pain. Now, that's essentially what's happening at the hip when you've got hip impingement. But more importantly, what is it that's actually causing it? What's making this happen? Now, we live in a world now where we're in this position all day, like a right angle, sitting for long hours. Now, if you imagine if you're sat with your knee up like this, that front of the hip socket over time just gets tight and the back becomes quite weak because we're not using our glutes anymore. And that can create an imbalance, causing to get impingement in the hip. Also, things like training hard in the gym, doing deep squats and lunges can sometimes irritate that hip if there's not enough kind of mobility, but we're also lifting heavy weights. It's kind of like forcing a door past its natural range. Using heavy weights, it starts to scrape the inside of that socket, which can cause irritation and hip impingement. Also, the hip shape itself. So some people are actually born with subtle differences on the inside of the hip. Now, it doesn't mean there's anything wrong with you or anything like that. It just means that your hip might need a little extra care when it comes to moving it under load. And then also things like previous injuries or muscular imbalances can also cause this hip impingement. So for example, if you have a stiff lower back, weak glutes, tight hip flexors, they can all kind of work together to essentially cause that hip impingement. And the reason for that is if you imagine all the muscles that surround the hip keep this in place. Now if these are weak and these are tight, it's almost forcing the hip into the socket. So then when we go through the movement, it can again cause further scraping, further impingement. Now this is something, not to worry, this is something that we deal with quite a lot, and a lot of the time, 90% of the time, it doesn't require anything like surgery. The key is to restore the hip movement, strengthen the muscles around the hip, and basically that allows so at the clinic, what we're going to focus on is releasing the tension to improve mobility so that the hip can essentially move more freely again. The second thing that we start to focus on is strengthening the muscles around the hip, especially all the posterior muscles like the glutes, the lower back and things like that. And then we need to look at retraining the way that you're moving so that you can get back to doing the things that you love doing without worrying about obviously that pinching feeling that you get or that feeling of that hip locking up. So I'm going to take you through 3 simple things that you can start doing today to ease that pressure on the hip. So the first one, this is going to be for mobility. So take your hands back behind your back, sit back, feet flat on the floor, and then what we're looking for is internal, external rotation at the hip. What's happening here inside that hip joint is that kind of rotation. So if you can, do it without the hands. You want to try and get your knees to touch the floor each side. You can literally do thousands of these a day because we're not lifting any weights, we're not really pushing for any resistance. And this is just going to help to open out that hip. So left to right, left to right. Then what you're going to do, stop on one side, take yourself over to that side, and with this leg here, we're going to lift up, tap the heel, and then come back down, tap the knee. You might find this quite difficult, but again, it's just working through that normal range of movement, which you probably lost if you're having that hip impingement. If any of this causes hip impingement as well, don't push through the pain, okay? Internal, external rotation. So this is the first one for your mobility. Good. Then we've got strengthening. We want to try and strengthen the muscles around the hip. So specifically, let's focus on the glutes here. So take yourself down into a sideline position, knees at about 90 degrees. And then what you're going to do, first of all, is go into your clams. Now clams, a lot of people kind of throw their hips back and they open up really wide. Push your hips forward, you'll naturally get to a point where you can't go any further. That means that you're doing it right. It kind of feels like it's blocked. So we're going to go for 10. Once you've done that 10, take your knee and your foot off the floor. You're going to drive your knee into your chest and you're going to push away. Again, we're going to go for 10. Once you've done that 10, we're going to start with the knee here. We're going to drop the knee to the floor. You'll feel that stretch across here. And then you're going to drop your heel behind. And you're going to start to feel that burn through the glute. So you can split this up, so you can do 10, 10, 10 and rest in between, that's absolutely fine. But as you get better, if you can go through the whole kind of 30 reps, that's really going to get that glute fired. And then relax again. Good stretch that's really going to help to release the hips is the pigeon stretch. It's a lot better on an elevated surface, so if you've got the back of a couch, the bed, something like that, and pop your foot on top, and then from here, we're basically going to fall forwards. You're going to feel that really pulling through the hip. Again, if it causes pain, don't push through the pain or anything like that. There's lots of different stretches that we can do, but this should feel quite nice at opening out that hip. And what you can also do is kind of a mobilisation in this position as well. So if you come to the side, and then you pop your leg on the side, I call this the ultimate pigeon stretch. And then what you do is from here, almost like you're doing a deadlift, you take your hands and you come down. So what's happening here is starting to pull, but rather than just pulling and pulling and pulling, we're going to mobilise. So you're just kind of going through the middle. So it's quite nice to do some mobilisations first, get that hip moving, and then go into that stretch at the end. That's it. Now with all these exercises, you want to be doing these daily for the next week, and you will start to notice that you start to move and feel a little bit better. Now if you are still feeling that pinch, however, or that pain in your hip, and you don't want to wait anymore, you just want to get this sorted, go ahead and send us a message today, and let's get you back to moving freely and living without pain.